Hey, Dr. Swetech here from Swetech Medical Center, and today I would like to talk about thyroid disease. So back in training, when we had to give out lectures and whatnot, I had a slideshow, and on one of the slides I put symptoms of hypothyroidism, and I had about 100 bullet points, basically listing every possible symptom I could come up with. And there's some truth to that. So what is the thyroid? The thyroid is a gland in the neck. It's controlled by the pituitary hormone, and basically it gives off thyroid hormones, and what these do is they modify the metabolism of the whole body. Your body has to adjust the amount of thyroid level depending on your overall stress and things that affect you. So most people, their body can keep this under control. There's a very common thing called Hashimoto's hypothyroiditis. It's basically an autoimmune thing where your body attacks its own thyroid, and your body tends to make less thyroid hormone in general. When people's thyroid level runs low, they generally have all the sluggish effects. They feel tired, they feel slow, they feel cold, they feel basically cold intolerance. Your metabolism isn't keeping up, generating enough heat. Their blood pressure, their pulse can be on the low side. It can be quite dangerous. Back in the day, before they knew how to treat this, people would end up in comas, and they even have heart failure and things like that. The list is quite large, but you tend to feel run down. People can feel depressed and whatnot even. So usually with low energy, you have hypothyroid. Usually your free T4 levels and your T3 levels are a little bit on the low side. Your TSH runs inversely with that. Basically, your body's TSH number will go high because that's the pituitary trying to crank up its signal to get your thyroid levels back up. People with low thyroid tend to gain weight. A lot of times when people have a hard time losing weight, we check this and dial it in. I usually replace it with Synthroid, which does a great job. There are some people that need their levels fine-tuned. It is a little tricky with insurances. They don't like to pay for the other ones, but I've had a few patients that we dialed in all their hormones and they feel quite a bit better overall. So on the other spectrum of things, there's high thyroid. High thyroid, you tend to be overactive. You have heat intolerance. Your metabolism is going very fast. You can be sweaty. You can get your pulse can go fast. You can get arrhythmias. You can also get arrhythmias with low thyroid too. High thyroid is dangerous because it can push your blood pressure up. It can also cause heart failure. It can thin your bones, and obviously these things can all be problematic too. One thing that I didn't really mention, so when I ask people when they have a symptom of either high or low thyroid, I ask them, have you had any skin or nail changes? A lot of times that's a good sign. When your thyroid's high or low, it can affect your skin and nail. And another thing is hair. When people come in with hair loss, there's a lot of causes of that, and I'll make a lecture about that soon, but a lot of times their thyroid levels are off. You straighten them out, their hair goes back into good shape. So there you have it. With high thyroid, there's a few medications, PTU and methimazole, and these basically bring the levels down. High thyroid's a little bit less common, but we do see it here and there. It's a little trickier to treat sometimes, but not necessarily. So let's kind of change gears. So that's talking about the high and low thyroid. Let's talk about thyroid nodules. So the thyroid's a mass, so the thyroid's a gland in the neck, and in normal scenarios, it should barely be feelable. It should be about 25 grams or less. If you can feel it, it could be a sign that it's being irritated. But if it does warrant an ultrasound to kind of check in. If you feel like an asymmetry or a hard nodule, it is warranted to do an evaluation. Basically, I like to start with ultrasound. Ultrasound has no radiation. If there's anything there, you can either keep an eye on it or get a biopsy. In all honesty, it is almost impossible to tell exactly what these nodules are without a biopsy, but sometimes if the features are less concerning or they're smaller, it's reasonable to keep an eye on things. Thyroid cancer is out there, and we see a decent amount of cases of it, so if you notice any swelling in the neck or neck masses, you definitely should get it checked out. in general, this is one of the more survivable ones, but you definitely want to get it under control and discovered and taken care of as soon as possible. So we talked about low thyroid, high thyroid, and then neck masses. I could talk about that for a while too, but I think that pretty much summarizes, gets you a little bit of a starting point. Yeah, so if you have any of these issues, feel free to get in. We'll take a look and kind of guide you in the right direction. Thank you and have a great day.